This video talks about customizing SeeMore. When you go to the new exam screen and you input patient data, things like that, we can preload facility names, so if you move to different offices you can easily change that without having to type it in, as well as clinicians. And when you hit Start Exam, you can see it populates the screen here. So in order to set the facility and clinicians up, we go to the Preferences tab, and you can see facility over here, and let's just add another one. We're going to add office. Click on the Add button. Office is now added. Let's say we're no longer going to UCSF. I just highlight UCSF, click on Remove, and that's gone. It works the same way for clinicians. I can add Dr. James Peralta. Click on Add, and he's now added. And if you can see, we go to the New Exam tab. We now have Office as a possibility. We have James Peralta as a possibility. In a previous video we talked about image storing and how to change the default from your hard drive to a network drive, and we talked about cine frames and grid lines, so we won't talk about that here. But let's talk about how to save customized settings for when you're scanning. We come preloaded with a default, which is for this particular probe 3.5 megahertz with a depth of 15 centimeters. So if I'm scanning, let's say that I really want to change the pulse frequency to 5 megahertz. I want to scan at 10 centimeters depth, and that I want to bring down the midfield DGC a little for this setting, and I'll adjust the contrast. I can change any settings I like, but let's say this is a setting I really want to use on a lot of patients. I freeze the image and I go to the preset, and I'm going to call this, I'll call this 5 megahertz because that's a setting I would use a lot for that. I click on Save Settings. Yes, I'm sure I want to save this. This is now one of my choices. So if you see, if I go, I've got a whole bunch of other settings saved, and you can see if I change a preset, like let's go to the default, take a look at the DGC and the other controls. They all kind of jump and they change because I'm going back to the factory default setting. And you can see that factory default's 3.5 megahertz at 15. If I then change back to the one I just saved, which I called 5 megahertz, we jump to 5 megahertz, 10 centimeter settings, and all the TGCs, intensity and contrast are changed. So that's a very easy way for me to save my favorite settings. Thank you for watching, and please refer to your user's manual for more information.